Council President Sandy and members of the council, I'm Michael Dulitz with Grand Forks Public Health. I'm going to provide an update on our COVID-19 dashboard, as well as provide a little bit of a vaccine update as well. So overall, when we look at our dashboard, we made a lot of progress in the past week. Unfortunately, today isn't as rosy as it was last week when we did get down into the green on our dashboard. We have had a slight increase in our cases per 100,000, moving from just under 10 up to 14 per 100,000. We have had a decrease in our testing that we've been able to absorb pretty well, but a slight increase in our percent positivity that has put us back into the yellow. Looking at our case rate comparison, I zoomed this in a little bit, taking out those outliers when we had the outbreak to give us an idea of where we're at right now. You can see we did dip down into the yellow for our cases per 100,000, and it has steadily climbed back up. I'm not sure if this is part of a overall rising trend or if it's just kind of an aberration or anything like that, but it is something that we will keep an eye on. When we compare it to other communities or our other peer communities in the state, we are seeing similar rises in other places, which does lead me to believe that it could potentially be, something more of a fluke after the holiday than something sustained. Our overall incidence curve does continue to kind of flatten out. Our projections are looking good to keep our case rates relatively low. Moving over to the vaccination side, we've made a lot of progress in vaccination over the past couple weeks. We are up to now 15% of the population of Grand Forks County having received at least a first dose of COVID vaccine, and that's about 8.5% for a population that has received 2 doses of vaccine, so just short of 10%. The third number on there is the 10.5%. That is the 2-dose coverage rate for the vaccine eligible population. So for the 2 vaccines that we currently have available right now, the Moderna vaccine and the Pfizer vaccine can be given down to 16 years old, the Moderna down to 18 years old, so that does cut out a large part of the population that can get the vaccine. So to get to 60%, to get what we presume to be herd immunity, we have to get a larger portion of that 16 plus population covered so we can reach that 60% for everybody. Overall, we have about 5,900 people who have received their 2 doses of COVID vaccine. When we look at Grand Forks and Polk County, making up the metropolitan statistical area, fortunately, Polk County's been kind of following our trends pretty well. Their vaccination rates have been pretty strong. Some people from Polk County are eligible to come to Grand Forks County and get vaccinated, and that's because of our partnership with Altru. We are using Altru's allocation at the Alair Center in addition to our own, and so we also need to vaccinate individuals who would otherwise be eligible to get vaccinated through Altru. And likewise, some people from Grand Forks might get vaccinated in Polk County. It's all a federal allocation. They do assume that there's going to be some crossing back and forth. Overall, one county is not shorting the other county in vaccination that we've seen. And we're so closely entwined that we want to see strong vaccination rates on both sides of the river. Looking at our kind of self-entitled quest to 60%, so 60% being the presumed herd immunity rate, and that's based off of studies that the CDC has been using in their, in kind of their planning process for herd immunity. So Grand Forks is kind of knocking it out of the park right now compared to our peer counties at 8.5% of our population having 2-dose coverage. We have been kind of competing back and forth with Cass County, but we did make that big jump in the past week, in part to the extra COVID vaccine allocations we've been getting, as well as, I think we have a pretty good system for getting vaccine to people, and that is starting to benefit us. Looking more regionally, North Dakota is leading our peers, our surrounding states and provinces, with Manitoba being in last place with about 1.9% of their population. Overall vaccination rates, again, this does, this does paint a really good picture for the work that we're doing in Grand Forks County. When we look at all doses given per 100,000 population and compare it to our peer counties in North Dakota, as well as the statewide average, we are kind of setting the pace as far as the amount of COVID vaccine that we are getting out. When we look across age groups, Grand Forks is a little bit more in the middle. When we look at the 80 plus and 70 to 79 age groups for getting their first dose of COVID vaccine, Ward County is beating us in that area, as well as Burley, but we do have a strong rate in that 70 to 79 age group. We did get to the 70 to 79 age group a little bit earlier, so below 75 age group a little bit earlier compared to the other communities. Looking at our first dose vaccine by age group within Grand Forks County, you can see the under 19 to about the 50 to 59. A lot of those people got vaccine doses early, primarily based off of their employment as healthcare workers, first responders, or other phase 1A priority groups. And then you can kind of see when we move to the phase 1B, you can see kind of how things have exploded in those age groups as we've added those groups on. When we look at our 80 plus age group, we are kind of right in the middle of everybody else. One final thing I wanted to touch on vaccine rates and COVID in general is looking at our cumulative deaths. Those do seem to have flattened out quite a bit as we've gotten away from the major outbreaks that have been happening. So that does seem to be one benefit of the lower case rates that we've been seeing lately. So looking at our bottom line, we still are doing very well on vaccination in Grand Forks County this past week. Unfortunately, due to the weather that's been happening outside of the area, so Chicago area on south, it did delay the arrival of our vaccine for tomorrow's event, so that will be getting rescheduled, but we will still be getting a full allocation for Saturday, so we should still be able to keep this up pretty well. We have reached the green level on our dashboard. Hopefully we can get back down to green. We did see a little bit of an increase in hospitalization, including an increase in individuals with that are hospitalized in critical care. That's something we will be keeping an eye on. There has been a little bit more variation in hospitalizations lately. And then, we would always do well with more vaccine if we could get it out. Our model is seeming to scale well as we've kind of grown it from where we started. So the more vaccine we can get, the more we can get it into people's arms. And then opportunities are essentially the same as last week. Our threats, we did see a decrease in long-term care related COVID testing, which did lower down our tests per 100,000, which did increase our percent positivity a little bit. Looking at how we can kind of better depict where we're at in that area, we have looked at potentially adding in those antigen tests, because they are making up about 50% of our total testing right now. So like the testing events that you're seeing at at the malls in Grand Forks, we offer it to individuals at the high performance center testing events, and then some entities have started using antigen testing as well. With that, I am open to any questions.
Any questions for Mr. Dulitz?
Yes, if I may, Mr. President Sanders.
Mr. Weber?
Mr. Dulitz, the reference to 60%, you indicated that that's according to CDC guidelines. Do we actually have a fixed percentage that's determined to be herd immunity at this point?
Councilmember Weber, so just to clarify, that's, I don't want to overstate that it's a CDC guideline. So where I pulled this from was a JAMA, Journal of the American Medical Association article, where they discussed, the needed rate of vaccination for herd immunity. that, that article has been cited by the CDC when they are talking about the rates needed for herd immunity. Basically what they say is it's between about 55 and 65 is kind of the range for herd immunity, and then they gave the number of 60 in that article as kind of the midpoint in there. And so that's where we're getting that reference from for that 60%.
Thanks.